the third lecture will be by Dr. Priti Jaykar, Madam, facing litigations, inspections, and committees. I request Dr. Priti Jaykar, Madam, to come on the dais, and I'll be introducing her in short. She is a general surgeon and HFN oncosurgeon with over 20 years of experience and practicing at Vileparle, Andheri, and Kurla. Madam, I am from Vileparle. She is MS DNB surgery with flying colors and is a double gold medalist at the FCPS surgery exam, gaining vital cancer surgical experience at world-renowned Tata Memorial Hospital, Parel, Mumbai. Fellowship in HFN oncosurgery. Actively, she is managing general surgery, GI surgical work, including laparoscopy and cancer surgeries. In addition, she's got diploma in hospital administration and medical legal systems. She has a master degree in medical legal practice. She has got special interest in laser surgery, breast cancer, thyroid, and parathyroid, parotid glands. Sorry. She regularly conducts and moderates online medical legal seminars and has featured on radio interview on medical issues on multiple occasions. So over to Dr. Priti Jaykar, Madam. Sorry, Madam, there is a limited.
I'm sorry, this is reading good afternoon because my presentation was in the afternoon. So please read it as good morning, Pune. Thank you so much, ma'am, for your kind introduction. A very good morning to all my respected colleagues who are attending this very relevant meet by IMA Pune here, who are all in person, and all of those who are zoomed in online. I think there are almost some 113, 116, what I saw last. I'm grateful to ma'am, Dr. Meenakshi Deshpande, her team, Dr. Navrange sir, and AICL for letting me be a part of this very important seminar, which is Save Your Practice, and inviting me to touch upon this very feared subject of litigation. I think a lot of our lectures are going to be intertwined. You will all agree with me, I think everyone present here and everybody listening, that our field is very unique. We are constantly learning, improving every day with every patient. And since we just celebrated Guru Purnima just a few days back, I would like to thank all my teachers. I think Uttari sir is here, all the speakers who are here, and the chairpersons for being there to teach us and guide us through our entire journey. The lineup of today's talks is very impressive. And a lot of important topics are being covered by very eminent speakers. Being a surgeon, my focus on today's topic will be from a doctor's point of view and not purely legal. And the aspect is, I think that aspect is best dealt by legal specialists. Our life is already so hectic. I think the way we function from our day-to-day, morning to night, getting some time out for even our own personal work, I think is pretty difficult. And today, I think medical practices like this guy, we are just trying to strike a balance. So naturally, when we are faced with an additional headache of maybe litigations, inspections, or any committees, our usual reaction is, let's run away. No more additional headache. But unfortunately, that is not an option here. Though it is troubling, is there a reason to be concerned? Yes. Unfortunately, a big yes, because this was a survey which was conducted in 2016 by National Law University, Bangalore, which said there was a 400% increase in the number of cases filed against doctors. Now, the data is very skewed. We are not really able to get a lot of data properly, but just a few cases which I could get clearly was there was a cases of almost around 329 cases recorded in Karnataka Medical Council between 2012 and 17, out of which 33 were found guilty. And we had a total of 3,200 odd cases recorded in 2018. 19 saw little less, 3,000 cases, out of which 430 reached the state court. The most important lines are here. Out of all the cases, only 15% cases approximately were found to be genuine. Now, what does this mean? That there were almost 85% of doctors who had to go through and the entire rigmarole of litigations, all the trouble that goes in, and we were found not guilty. So you're talking about 85% which were not found medical negligence. Now, all of us doctors are going to face this situation sometime or the other in our lifetime. And for obvious or perceived acts of omission or commission, so the only thing we can do is be prepared. The keyword medical negligence on Google picks up around 11,000 entries. So why are litigations on the rise? There are a few key reasons which I have picked out. Most common and the most difficult or the most unfortunate is this, where there is a complete lack of communication. Your understanding, my teaching, my explaining, there is something which is going off, which is the reason why there is a big communication error. Now, this communication error leads to a lack of trust. All of us are dealing with patients who are basically Google doctors. So they come in with the entire knowledge on Google, they come and meet you and they only want your validation, and they will decide if what you're telling the patient or explaining or giving the treatment is actually what they want. If that was less, we have a WhatsApp university. So you have forwards and forwards of people sending information, which so-called is supposed to be true. So you have people coming up with diagnosis. You have, I think the recent 2 years of COVID has given us multiple lines of treatment, and there are people following it, and there are people who are landing up with trouble because of it. So there are easy home-based ventilator managements which have also come up on WhatsApp. Now, this unfortunately is one of a key reason why the mindset of patients is changing. It's gone to a litigation mindset because the amount of payouts or the compensation has been huge. You're talking about crores. There is no clear-cut guideline. There is no capping. So we are landing up with amounts which are different in different courts, and we are landing up at the receiving end. Now, can anybody tell me what this picture is, the last one, which is on this side? Sorry? No, the last one, with the horses. Okay, now, this is a medieval picture of a sport called jousting. That I find is one of the most saddest part of our profession, because this is something which can be easily prevented. Now, all of us are seeing patients as second opinions. We are seeing patients who have come in from somewhere. So just as an example, I'm a doctor. So I see a patient who's been operated by maybe a Dr. X. He comes to me. There is a wound discharge coming in. And I very casually say, oh, this doctor, okay, he has a lot of complications. I have dealt with a lot of them. So you put a seed in the patient's mind. You're taking rounds in the hospital and you've seen a patient and you just casually say, "Arey Baba, ye doctor ne ye dawai diya hai, wo barabar nahi hai." The patient hears it, the relative hears it. This can happen even when you feel that there is nobody around you. And you're talking to your intern, you're talking to your resident, and there is somebody passing by, that person can hear it. So be extremely careful when you're actually passing a comment against another doctor, because that can result in a lot of issues. Now, the last, this is a very, I have to call him a two-edged sword friend, which is the media. This is a case which has just come up, I think a few months back, in new medical college come up in Lakhimpur. A lady comes in for cesarean section. There is no electricity, there is no power backup. Lady dies. Guess who's responsible? You would say administration, you would say the electricity board, but no, it's the doctor. The doctor is suspended. So you land up having a simple fact that we are soft targets. We are responsible for everything. If there are no medicines in a government hospital, we are responsible. If there is no equipment available, we are responsible. So it doesn't matter whether you're in a private setup or a government setup, doctors are soft targets. So beware. What are we up against? Why are we doing this? The consumer or a patient can file a complaint against you in all these courts. In the medical council, criminal court, civil, consumer. Now these sounds like two words, but they're looking at different levels. Consumer court, district, state, national. Civil, district, state, national. I mean, Supreme Court. The highest being the Supreme Court. Your medical council, you have a state, you have a national. So you're looking at a series where you go into one, you appeal, you go to the next. So you can imagine the amount of harassment that we are going through on our daily lives, fitting in our work, trying to manage this. Important being that he can file it in all the above simultaneously. So you can just imagine the agony that you're going through if you're looking at even one or two of these that you're going through with any patient. So this is very important, that you need to know that you can have a litigation filed against you through all this. Important points or salient points in a consumer court, I think sir is already covered. There's a deadline of 2 years. They can only give compensation. Civil court, again, only compensation. Your state medical councils can suspend, reprimand, can give you a warning or removal of your name from a register. A criminal court can give you a sentence and or compensation. So what is litigation? It is an act, process, or practice of settling a dispute in the court of law. Now, today, what we're going to tackle very shortly is how do you deal with a legal notice? Is there a procedure to be followed in the consumer court? Police, I have written the letter, but I think sir, Dr. Irande sir is also taking it up later. And what do you do when you get a criminal court summons? Now, a notice is basically a formal communication to a person intimating the person that intimating the other party of your intention to undertake legal proceedings against him. A big word basically means he's warning you that I'm going to file a case in court. Now, this can happen in a civil case, can happen in a consumer case. There's no provision of this in the criminal court. Now, it is usually written by the plaintiff's advocate, and you will get it by registered AD or by courier. So when you get a legal notice, what is the first reactions that we have seen us doctors getting? Panic. Okay, all of us start getting panicky because we feel that it can't happen to us. We are such good doctors. We are doing our best. Why will a patient actually file a complaint? I have only done good. Panic leads to other emotions. We have a feeling that there is profound sadness. So we have doctors landing up with depression, frustration. We have doctors even landing up with suicidal thoughts. They have change of work. There are doctors who have actually changed their work. See, we get hurt very easily. We may be treating life and death situations, but we get hurt very easily. So we do our best. We work unearthly hours. We handle life death situations, but the same doctors crumble when you have something because we have not learned this. It is not part of our curriculum. So we really don't know how to handle it. So maybe if you have a friend going through it or you read it in the paper, you say, oh, so sad, so I'm feeling so sorry for him. But if you are in the place, the kind of reaction you could give could be any of this. So let's decide not to become emotionally charged when you're faced with a litigation. And today, since it's a reality, we have to be prepared. So a legal notice is either served by registered post or courier. So what do you do? Step one, don't panic. You need to read the documents very carefully. Now, it usually, since it's written by a lawyer, no medical terminology, so we'll end up thinking it is more like Russian or Greek. Latin, I won't say, since we already know a lot of Latin in our language. But the Russian language inside seems very odd because we really don't know how it is, what it's leading to. Read it again. You will realize that you can remember the patient. So you're looking at something which could be 2 years back. So you're looking at patients every day. We have general practitioners reading more than 100 patients a day. So you may not remember what this patient is about unless you read it again. So you read it again. You ask the papers to be brought out from your medical legal department. Read the history of the patient. Read what the patient is asking for in those notes. And when you go through your records, you will remember more. Make your own notes on a separate diary so you know what exactly the patient is about. When you read the notice, also know the patient's details, who has filed it against the patient, advocate's address. This is again important because as of now, you're looking at a consumer court procedure where if a patient is in Assam, he can file a court procedure for you in Assam. So you need to know where the advocate is located because his address will be on the top part of the paper. So in that case, we have AICL teams or who are placed all over the country who can help us. Now, when you do this, make sure your notes are checked by a medical legal expert. Most important. Very important. Here he's our friend. So you have to make sure that you employ a good lawyer. One with experience in medical negligence cases, not anyone. So he has to have a good experience with this. You have to formulate a draft reply or what we call a submission with him. The reply is written by the lawyer in his language. It has to be precise. You reply to every point that is mentioned in the legal notice. Deny allegations where it is indicated. No extra information. Very important. Don't give any more extra information. Stick to what is written in the case papers, nothing more. And again, I'm repeating, don't volunteer any new information. Now, I've come to this slide. Important. Can I have a show of hands as to how many of you all have indemnity more than 1 crore? Okay, more than 1 crore. Okay, now this is again important because even today, with all these judgments coming in the media, say a few years back, except for maybe organizations like this, people are not aware of the kind of judgments coming out. But the new CPA has come up with an increased level. You're looking at a district commission, which has come up with a level of 1 crore as compensation charges. So earlier, which was 20 lakhs, is now 1 crore. So it starts at 1 crore. Now you're looking at what sir said, if you're giving 50% as a payment which has to be made, even if you're appealing, where do we have the money? So it's always safer, take an indemnity insurance of at least 1 crore and above, and make sure that you are covered. Now, this is important because in case you're served a legal notice, the first thing you do is inform your TPA. Now, this is like your Mediclaim, your healthcare Mediclaim, where you have a cashless and a reimbursement facility. So you need to check. See, most of us just sign the papers. We give the premium, we sign the papers. You're not looking at the key points or the notes or the points written in your insurance. But one thing will be you have to inform them first. It is a priority. Why? Because if in case there is a payout which has been awarded against you, they will say you didn't inform us, we are not going to pay you. So make sure they are informed first. Send them a copy of the letter that you have got. You have to just tell them that such and such a copy has reached you and that you are denying the allegations. You don't have to give them any more information. A lot of them may assign you their lawyer. It may be a part of their protocol, or you might have to make your own lawyer arrangements, but that also is a part of your agreement. Do check the credentials of the individual who has been assigned to you. If you're satisfied, retain it. If not, there might be conflicts of interest. If there is a case which has been filed against multiple doctors and if there is a hospital involved, same lawyer may have their own pros and cons. These are the common defense tactics which have been used in most of the medical negligence cases. Most of us may have some use of this during filing. Now, in a consumer court, remember that you may not need to be present there. It's good if you can, but it's not mandatory. Now, if you have a draft reply, which you have submitted with your lawyer, and the allegations are made and you have denied it, it is better to attach statements of experts or an authority or literature and send it across. Now, most of the times this should be enough. And if in case your the literature or anything evidence that you have proved is enough, that might stop it there itself. The plaintiff may want you to re-reply or give you another reply after this. Again, it goes back and forth till finally you have a outcome. Now, this outcome can be favorable, unfavorable. If it is unfavorable, you can appeal to a higher commission within 30 days. Your highest resort is the Supreme Court. Now, the problems that can occur, now this has happened in multiple cases, is if you are a part of a team and there are a team of doctors who are involved in the litigation, if there is a hospital related error, are they going to accept it? Are they going to say yes? One member decides to blame the other. Now, this has happened on multiple occasions. And if the hospital does not cooperate, what do? Now, this is a case which has just happened in Mumbai a few months back. A patient herself was an anesthetist. She had undergone a cesarean section. The gynec unfortunately left a mob behind. A big hospital in Bombay. Okay, you say fine, something went wrong. Who should the patient have filed a complaint against? The gynec, fine. The OT sister, fine. The hospital, fine. She filed it against the anesthetist also. Now, where is the anesthetist going to see if there's a mop left inside? But the trend is that today's complaints are sue anybody and everybody. If you have come to the ward and you have checked the patient, you are part of the list. So you have to be aware that in case you are not even primarily involved in resulting in whatever has happened to the patient, you may still be sued. So make sure your notes are proper. So what could be the solutions for this? If being together is going to help your case, go ahead with it. If it is not, then introduce your own lawyer and make sure that that lawyer also knows what is happening, so you're not going in different directions. And don't try and throw your colleague under the bus, okay, because that can again prove detrimental. Now this is again a new thing which we have, mediation, which is available, but this is only available when you get the legal notice. The patient might tell you that, Baba, I'm looking at this much money. You can obviously negotiate, and if you only feel that the result may not be unfavorable to you, you can use this option. I would not recommend it if you feel that you have not been negligent. Do consult your lawyer and the indemnity insurance regarding the same about the payouts. It has to be formally done. It cannot be done just verbally. And in case an ongoing civil case, we can do it, you making sure that the judge is aware of it. There is no option in a criminal case. Now, in a criminal court, the patient cannot directly file a case in the criminal court. You're looking at a totally different procedure. So if the plaintiff has gone ahead, there is a grievous injury, there's a death, and the police are not helping, only then I think there's a provision in which they can go directly to the criminal court. And it begins with a police complaint filed by the relatives. These are again points I think Mr. Irande sir is going to be helping us later. But yes, you can be arrested only if certain provisions are in. You can get bail and an FIR only later if the thing has been proved against you. So this is a usual proper procedure, just in short, where a complaint is registered in the police station of the particular jurisdiction. The details are recorded in their register. The police asks you for evidence, you give the case papers. Written letter is a must. Please remember that. You submit the papers, the police takes the papers to an expert committee, decides if there is actually a chance of criminal negligence, and then they can file an FIR. Do not entertain oral requests. Politely listen, take his complaints, take it in writing, acknowledge the letter, read the letter properly, check the details again with a medical legal expert, and then hand it over. Make sure that you're getting a acknowledgement that you have given it. Do not volunteer information in the police station. This is very, very important, because you'll end up in a situation where you're a little worried because you're facing a police. All of us have been brought up with that fear of police. So if they ask you a question which is not really a part of what you're going through, don't answer it. Tell them that, okay, fine, whatever you want, give me in writing, I'll reply it back. So make sure, again, I'm telling you, make sure that before you hand your papers over to the police, that you have checked it with a medical legal expert. Double check your notes. A small word and it changes the meaning completely. Okay. Thank you. Okay, so I think all of us have read that in detail. Now, these are some tips as to what to not do in court. Okay. Now, see, this is a situation I think we'll be most comfortable in an ICU with the patient, and we are trying to ambu the patient. We're trying to treat the patient, but in a court, we really don't know what we are really expected to do. How many of you all have had court experiences? Okay. Okay. So you all know it's a completely different system. You're looking at a new environment completely. So this is what you do. Okay. You do not speak to the relatives or their lawyers. Okay. You don't try to interact with them and tell them that, okay, fine, let's try and, I did this, I did that, but still, something went off. So even if you try to be nice with them, it may not work out. So it's better not to speak to the relative or the lawyer because he's already gone ahead. So you've already crossed that stage. Don't speak ill about the hospital colleagues. Don't volunteer any extra information at that time. Don't appear arrogant, rude. Don't answer till you're not sure what the question is. Don't tell lies. Okay, very important. Don't tell lies. And in a court or criminal court, never ignore a summons. Okay, it can lead to a warrant. You have to try to take these things seriously. There are time frames involved, even in a notice, 7 days, 15 days. Try to stick to it. If there is a problem, make sure that you have done the process again legally. You need to be present on time. A criminal court has to be taken extremely seriously. Dress formally. Your counsel can help you prepare you for the type of questions. Now, I have faced one or two, so I know how ridiculous the opposite party. They don't know what they're talking about. They don't know medicine. So they will ask you questions that they think will help them, but it may not really be true. So make sure that when they ask you questions, you understand it. So if you're not sure, ask them again and answer truthfully. Don't answer yes or no. They'll ask you, ye karna chahiye tha kya? You don't answer yes or no. It may not be a yes or no question. You say, I will explain it. It is not a clear yes or no answer. Don't get emotional. Don't get scared and stand your ground. Can we prevent litigation? Yes, we can definitely try to prevent them. The most important thing is we have to get back to the old doctor-patient relationship. This will come only with good counseling. You have to be a good listener. You have to communicate well. A lot of the new batches of the trainees coming out, I've really found them not able to communicate. It's like, ठीक है, gallbladder problem है, कल निकालना पड़ेगा. But what? Why? Explain, because the patient is not what he was 30 years back. He's not going to listen to you and say, fine, you आपने बोला तो निकाल दो. It doesn't work that way. Learn to talk to them. Take an informed consent. Strict record keeping is the only way out. Make sure that every line you do, right from your OPD till your discharge, has to be strictly maintained. Make sure that there is no excuse. You may see 300 patients a day. You may be operating 10 cases a day. If your records are not proper, nobody can help you. You cannot say that I was not aware of it. You have to be aware of the latest things happening in the medical legal world also. Even though the legal aspect is connected to it, it is going to affect our lives. Maintain the standard of care. Do not deviate from it. It will again backfire. Coming to the next topic, I think I'll just cover this very fast. Inspections are multiple, I think, mainly for nursing homes and hospitals. So you're looking at the inspections from the local municipal body, from the fire, from the NABH or infection control. The Bombay Nursing Home Act also has the provision for inspectors coming in. And I think the most important for all the radiological setups and GIDAC setups is the PCPNDT. You must remember that in case somebody walks in without letting you know, you can be polite, but you have to be firm. You have to figure out whether they are actually genuine. So ask for credentials always. Check it with the higher authorities if you're not sure, because I'm sure you'll have seen in the newspapers and in our journals that there are people coming in who are actually fraud. They're not people who are actually genuine, and they bamboozle us and let us go. So don't get bamboozled, don't get railroaded. Always check credentials, make sure they're authorized for that scope of inspection. Provide the necessary information as required and take acknowledgement when they leave. Beware of this category. I've written it in red because this is the people who have created a maximum problem, especially during COVID. So you have to be very careful of all these people who come in and walk into your clinic or your nursing home. Committees, I think towards the end, I really have not too much to write about this, but you do face committees once in a while, again, more in corporate setups. The important thing is take it seriously. If there is somebody who has approached you from a committee and you have to present your version of it, make sure that you're prepared. Just don't go walk in and say, okay, fine, there was no role of mine in this. Have your proof ready, talk to them with proof so that the thing matter ends there and there. I think I have to tell you all a big thank you for being such patient listeners. I think it was wonderful being a part here, and I must thank you all for this wonderful session that you all have organized. Thank you, sir.
Thank you for your speech, and we got a lots of thumbs up and hearts on the screen from online viewer. That itself states that this talk was very useful for our viewers.
Yes.
I would like to quote one Sanskrit subhashit: Ashwam naiva gajam naiva vyaghram naiva cha naiva cha ajaputram balim dadyat daiva durbala ghataka. So it means that when you are weak, only weak people are given bali. So you mentioned earlier, even there is a lack of electricity, doctor is held responsible. In Nagar case, we have seen there are fire incidents, but doctor was held responsible.
Yes,
so why we are weak? So we should come up on platforms like this, strengthen ourselves, sharpen our claws, and let's fight it together. Thank you very much.
absolutely true, sir. Thank you.
Thank you very much, madam. You want to ask question? Yes, sir. And you always laugh.
So the list is endless. But the only
Yes.
thing is, just keep your wits about, because like I said, we are more comfortable in ICU, with 10 patients beeping, but in a court of law, we are totally flummoxed because it's too new and we don't know
Yeah.
what's ahead of us. I
Yes.
think it should be taken as a part of our education curriculum now also, but I don't know when that will come in.
Yeah, it will come. Now I request our President, Madam, Dr. Meenakshi Deshpande, to come on the dais to felicitate Madam. And I request both the chairpersons to join the felicitation.
Coming from Mumbai. Come all the way from Mumbai.